I got in this field because I truly saw how gratifying it is to help someone's limb deformity and what have you. But I was with an orthopedic group for a while, a few years after my fellowship, doing major reconstruction on patients. The one thing that really got to me is that sort of post follow-up, that surgical follow-up where patients were off their foot for 6, 8, 10 weeks. And, everything went great. Surgery went great. But one thing I noticed about my patients was that they were really depressed because they just couldn't use that limb. And I never could resonate with that. I just didn't really understand that concept. Going through my training, it was just one of those things where it was just expected that the patient would be off the foot for that amount of time. You put them on some sort of blood thinning agent to prevent a DVT, and it started to weigh on me. I would do procedures per the x-ray, follow-ups, things were going great, but that patient was still in a lot of pain. From a mental perspective, they were just depressed, and it was weighing on me a lot. And it started to create a burnout for me almost. And, I was a couple of years into my practice. And that's kind of when I fell into this different technique known as minimally invasive foot surgery, where I basically I don't call them incisions anymore. I make a little poke and I'm able to correct the issue at hand. But the greatest thing about this technique is that the patients get to walk the same day.
Wow.